My name is Ariel Augustus, and today I'm going to describe to you how diet influences blood pressure. I'll be telling you about the dietary approach to stop hypertension, or DASH diet. But first, let me start with a bit of background about high blood pressure. Blood pressure is the force exerted by the blood against the wall of arteries. The systolic number is the pressure exerted when the heart beats, whereas the diastolic number is the pressure when the heart is at rest. BP indicates blood pressure based on an average of 2 or more careful readings obtained on 2 or more occasions. Hypertension stage 1 is when systolic blood pressure is between 130 and 139, or diastolic blood pressure is between 80 and 89. In other words, one or the other. Stage 2 is when systolic is greater than or equal to 140, or diastolic is greater than or equal to 90. Almost half of the adult American population has high blood pressure, 46% with blood pressure of 130 over 80 and 32% with blood pressure of 140 over 90. According to the CDC, high blood pressure is more common in non-Hispanic Black men and women, as illustrated by the middle columns in the chart. High blood pressure increases the risk of hardening and thickening of the arteries, which can lead to stroke, heart attack and heart failure, chronic kidney disease, peripheral artery disease, and loss of vision. There are several things you can do to improve blood pressure. You can eat the DASH dietary pattern, reduce how much sodium you eat, lose weight if you need to lose weight, and drink alcohol in moderation. No more than 2 drinks per day for men and 1 drink for women. You can lower your systolic blood pressure 30 to 34 points if you can do all of these things. In the original DASH diet study, individuals were asked to eat a controlled diet for 3 weeks. This is a typical American diet. Next, they were assigned to eat either a typical American diet with 8 to 10 servings of fruits and vegetables daily, or the DASH diet, which is lower in fat than a typical American diet, with 8 to 10 fruits, vegetables, and 2 to 3 servings of low-fat dairy. All 3 diets contained 3,000 milligrams of sodium per day, and the calories were adjusted to maintain body weight. The DASH diet lowered systolic blood pressure by 11.4 points and diastolic blood pressure by 5.5 points. The drop in blood pressure seen in the DASH diet group reduced heart disease by 15% and stroke by 27%. The DASH diet features fruit, vegetables, nuts, seeds, and dry beans. These foods are all good sources of potassium, which helps lower blood pressure. Lean proteins, whole grains, and healthy fats are also included on this diet. And don't forget dairy. These foods are also good sources of potassium, calcium, and protein. 4 to 5 servings of fruits and 4 to 5 servings of vegetables seems unrealistic, but keep in mind that what we eat as a serving is often 2 to 3 DASH servings. For example, 1 medium to large piece of fruit, a banana, or an orange is 2 fruits, and a baked potato or a sweet potato is typically 3 vegetables. Most salads, store-bought or prepared at home, is usually 4 to 5 servings, so it's not as much as it seems. A serving of dairy is 1 cup of yogurt or 1.5 ounces of cheese. Increasing the potassium in your diet helps lower blood pressure. Dietary supplements of potassium are not recommended because they can interfere with medications and in very rare instances can cause an abnormal heartbeat. Your potassium goal is 3,400 milligrams per day for men and 2,600 for women. Fruits, vegetables, especially low-sodium tomato products, beans, milk, and yogurt are excellent sources of potassium. That's why the DASH diet works. These foods are especially high in dietary potassium. I hope you see foods you like. After the original DASH diet study, a follow-up study was conducted to see if lowering sodium while on the DASH diet would additionally lower blood pressure. Participants followed either the control diet or the DASH diet first at 3,300 milligrams of sodium daily, followed by 2,400 milligrams of sodium, and eventually 1,500 milligrams of sodium daily. Lowering sodium from 3,300 milligrams to 1,500 milligrams per day lowered systolic blood pressure in all participants regardless of race, gender, or age. We get 5 to 10% of our sodium from what we add during cooking or at the table. There is some sodium which naturally occurs in food, but most of our sodium, approximately 80%, comes from processed foods or eating out. The target goal for sodium is 1,500 to 2,300 milligrams per day. Someone who needs fewer calories should aim for 1,500 milligrams, whereas someone who requires more calories may limit sodium to 2,000 or 2,300 milligrams per day. Eat less often luncheon meats and foods which are already prepared. Most sodium in the American diet comes from combination foods, for example, pizza. Eat fast food less often. Use smaller portion when it comes to condiments, cheese, and soup. And look for the lower sodium option of these foods as well as others, for example, sunflower seeds or peanuts. Less than 140 milligrams of sodium per serving is a low sodium food. Over 300 is considered high in sodium. The DASH diet studies determined that dietary potassium was an important balance for sodium. Look for lower sodium foods which contains more potassium than sodium. You can lose weight on the DASH diet, which is important as weight loss also lowers blood pressure. In this study, overweight and obese participants lowered their blood pressure following the DASH diet. But on the DASH diet plus weight management training, including supervised exercise and behavior modification, the participants lowered their blood pressure and lost 19 pounds. To lose weight, avoid spontaneous eating. Eat on a schedule. A snack of 100 to 150 calories is enough. Aim for 3 grams of fiber or protein per snack to help fill you up. Eat at home as much as you can to lower calories and sodium. Plan your menu so you don't have an excuse to get takeout. Avoid or reduce juice, lemonade, sweet tea, and regular soda. Most weight loss experts agree that liquid calories don't fill us up. Keep in mind that alcohol often stimulates appetite, and for some, we let down our guard and indulge more. Dessert should fit into a shot glass. You just need a taste. You shouldn't fill up on desserts. If you find it helpful, write down or track using a phone app what you have eaten. And don't forget to set your goal. Your goal could be that you want your clothes to fit more loosely. Wow, who knew that exercise can do so many things in addition to helping to lower blood pressure? Aim for 150 minutes per week or 30 minutes 5 days out of 7. If you are unsure if you should exercise, for example, you are experiencing chest pain, ask your doctor. Instead of eating just toast, have fruit with yogurt. Mac and cheese tastes great, no doubt, but a side of beans has potassium, fiber, and protein. To some of your favorite dishes, sneak in vegetables, like in the spinach lasagna. Make a sundae that will lower your blood pressure. Vanilla yogurt with granola and fruit. Measure your blood pressure when possible to detect any unusual changes. Take your medications as prescribed. They won't work as well if you don't take them regularly. Incorporate more fruits, vegetables, nuts, seeds, and dry beans into your diet to increase dietary potassium. And don't forget to use less salt and buy lower sodium products. Lose weight if you're overweight. Be active, move most days. And if you drink, do so in moderation. I appreciate you and know you can lower your blood pressure. Thank you.